Members of the military don't get too excited about a lot of things, but what we do get excited about negatively is we use the term in the Pentagon, protecting rice bowls. And you all know what that means. You got your little rice bowl of appropriations and all those things that you do, and that's human nature. You all aren't alone in that. When I started as a Marine, I started in rice paddies. So if you get the drift, in the late 60s, early 70s, so I really wasn't concerned about rice bowls, and I would suggest to you our veterans of today who served in places like Iraq and Afghanistan they're not interested in rice bowls. They're interested in what they observed in the desert and experienced in the mountains and all of that in different ways. So one of the challenges we have as a committee is to separate what is a rice bowl that's being protected for the right reasons or not. And I thank both sides of the aisle here on this subcommittee especially to make sure that we're doing the right thing for the right reason for the veterans in all cases, regardless of which rice bowl it may fall in. So having said that, Dr. Barney, am I correct to understand that under Medicare, Medicaid, and Indian Health Service all cover and pay for the full range of services authorized under an optometrist state scope of practice, and in addition, all major private payers cover and pay for those services, including laser eye care and other contemporary procedures included in an optometrist's state scope of practice?
Yes, that's correct.
Okay, with all of that being true, would it be correct to say that VA is currently an outlier among all private payers and other federal programs? And could you speak to the impact that this could have on our veterans' access to, in this particular case, eye care?
Yes, I think that would be a correct statement, especially if you consider the VA's community care program. The community care program does pay for laser procedures provided by an optometrist outside of the VA facility itself. If there is a restrictive optometry NSP, I would foresee a scenario where a veteran would not be able to get access to laser eye care by an optometrist within the facility, but could go outside the facility and receive that care. Okay. To me, that seems like not a very wise use of VA funds and resources.
Thank you. Ms. Setner, can you discuss the role that nurse anesthetists play in rural and remote areas, in this case, like Michigan's 1st District, which is not only rural, it's really, really remote?
CRNAs cover almost 100% of the rural health medicine in most of the states. Several facilities are now closing down because of an inability for access to have these care models delivered. So I could say that with certainty that CRNAs practice independently in these settings.
Okay, thank you. And finally, Dr. Harder, can you point to any evidence that shows VA is trying to replace anesthesiologists, as you say the ASA has claimed?
The move to remove physician supervision simply would have that opportunity arise, that there could be VA facilities that might, for various reasons, opt to not have physician anesthesiologists if they're no longer required to be present.
So, okay, we think that might be an outcome at this point. Nothing has occurred to this point that point to the fact of a lower standard of care.
Well, we would be, I think, speculating as to what might happen one way or the other.
Well, that's okay, because we have to, in all cases, now I see I got about 20 seconds left, we need to make sure, as best we can, as members of Congress, that what is being done at all bureaucratic levels within the federal government, in this case, especially Veterans Administration, that it's being done for the right reasons with outcomes for veterans in mind, not outcomes for the bureaucracy. And with that, I yield back.